Hi everyone. I'm going to explain you about the cardiac cycle. Right now, you should forget everything about S1, S2, S3, S4, and everything about the heart sounds. Now we are focusing about the cardiac cycle only, the filling and then ejection and all. So right now you forget everything about the other heart sounds. So this is very simple. You'll get to know only in 1 minute. See, you can start from anywhere. Right now, I will start from atrial systole. Okay, so what happens is in the atrial systole, uh, the blood inside the atria will move, and after the contraction of the atria, the blood inside the atria moves to the ventricles, and and these blood, as soon as it enters into the ventricles, the pressure inside the ventricle will start raising. Pressure inside the ventricle will start raising. As the pressure inside the ventricle will start raising, that will cause the closure of the aortic and the pulmonary semilunar valves, because it pushes the AV valves, that causes the closure of the AV valves, that is mitral and tricuspid valves. As soon as it closes, this chamber has become the blood inside and the high pressured blood. Now what happens is the ventricle start contracting. As the ventricle starts contracting, the pressure inside the ventricle will start increasing. As it started increasing, it will become more than the aortic and the pulmonary pressure. That will cause the pressure to move, the blood to move from the ventricle to the opening of the aortic and the pulmonary valves, and the blood enters into the atria and the aorta and the pulmonary artery. Now what happens is the pressure inside the aorta and the pulmonary artery will get increased. That will cause the closing of the aortic and the pulmonary valves, because the blood always moves in the direction of the high pressure to the low pressure. And same as for the valves, the valve closes from if the pressure pushes, it acts as the pressure pushes the valves. Okay, right now right now the blood has entered into the aorta and the pulmonary trunk, and it moves to the system, to the whole body and the lungs. Okay, right now what happens is now the ventricle start relaxing. Okay, the ventricle starts relaxing, and what happens is, as the ventricle starts relaxing, the blood inside the atria will start filling by the opening of the AV valves, because the pressure here is more, the pressure here is less, it is empty. So the AV valves open, and it causes the ventricle to move. The gush of blood moves inside the ventricle through the atria. Okay, as the blood moves inside the ventricle, that will cause maximum passive filling of the blood inside the ventricle. So now what happens is there are still some blood remaining, that is 30% of the blood, that will get filled inside the ventricle by the active contraction of the atria. Okay, and the active contraction of the atria causes the blood to move inside the ventricle. So the cycle repeats, and again I will tell you in brief in just 30 seconds. That is, from contraction of the ventricle, the contraction of the atria, let me see, listen to me. Yeah, I will tell you now. One, as the atria contracts, the blood moves inside the ventricles. As the atria contracts, the blood moves inside the as the atria contract, the blood moves inside the ventricles, and then the ventricular pressure will get increased. That will cause the closure of the mitral and tricuspid valves. The closure of the mitral and tricuspid valve, and the aortic and the pulmonary valves also closed earlier. Now what happens is the ventricles start contracting. That is isovolumetric contraction. That is, volume is same but the pressure starts increasing. Isovolumetric, volume is same, pressure inside the ventricle will start increasing. That will cause opening of the aortic and the pulmonary semilunar valves, as you can see here. That will cause the aortic and the opening of the aortic and the pulmonary semilunar valves. Okay, this will cause the opening of the aortic and the pulmonary semilunar valves. Now the pressure inside the aorta and the pulmonary vessels are increased. That will cause the closure of the aortic and the pulmonary semilunar valves. Now what happens is the ventricle is in a relaxed state. Okay, ventricle is a relaxed state because, and these two valves are closed and in a uniform chamber. That is, the volume in the chamber is not increasing because the blood is not pooling down. So now what happens is, since the pressure inside the atria will increase, that will cause opening of the mitral and tricuspid valve. That will cause gush of blood entering into the ventricles. Now what happens is, as the blood enters into the ventricles, there are some blood which is remaining inside the atria. That blood is moved inside the ventricle by the active contraction of the atria. That will cause the moving of the 30% of the blood inside the ventricle. So now what happens? Same cycle repeats. Now blood is in the ventricle. Now ventricle will get contracted. Isovolumetric ventricle will get contracted. Then closure of the mitral and tricuspid valve happens. Then as the blood starts increasing, as the ventricular pressure starts increasing, that will cause the opening of the aorta and the pulmonary vessels. This aorta and the pulmonary vessels, the blood moves inside the aorta and the pulmonary vessels. Now the blood now the pressure inside these two is more, so that will cause closure of the aortic and the pulmonary semilunar valves. Now is in the relaxation, ventricle is in relaxation phase. So now what happens is, next stage, that is isovolumetric relaxation. After that, the ventricle pressure, atrial pressure is more, that will cause gush of the blood inside the ventricle. So what now, 70% of the blood moved inside the ventricle, so 30% of the pressure inside the atria is still remaining. That will cause active contraction of the atrial systole. So the cycle repeats again. Thank you.